Hi guys, it's always a pleasure to speak to you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. I would like to speak about doing ultrasound in the first 3 months and especially at the week of 11, 12 and 13 weeks of pregnancy. And the reason why we do scans at this particular period is to rule out Down syndrome. We rule out Down syndrome at this particular period because this is the time where we can look at the thickness of the Naco at the Naco region, something in medicine we call Naco translucency. We look at that thickness because if the thickness is above certain millimeters or it's above certain measurements or certain dimension, certain measurements, we are able to detect that these your baby, if you continue the pregnancy and give birth to the child might have Down syndrome. We'll also look at the nasal and look at the nasal region to make sure that the nasal bone is present, because if the nasal bone is not present at this particular period, you might be running a risk of having a child with the Down syndrome. If we look at these two indicators and we find out that there is an indication that the child is going to have a Down syndrome, then we'll always refer the mother to the gynecological team, who in turn they're going to carry out further tests like chronicity, looking at the chromosomal disorders in the amniotic fluid, just to make sure that true the child doesn't have will not have Down syndrome. And if we find that that is the truth of the matter, then some medical intervention are going to be carried out. And the reason why we like to do scans during this particular time also is just to look at the length of the cervix, to rule out something called cervical incompetence, which will always cause miscarriage during this particular period. If the cervix is short, if the cervix is loose, then we can always advise the gynecological team to go ahead and put a McDonald stitch, which will also help us, or help the pregnant, or help the mother to carry the pregnancy to term. The next thing we would like to look at is the placenta. We would like to look at where the placenta is implanting. Is it low lying? Low lying means, is it covering the internal cervical os? Is it at the place where the cervix opens internally, so that it may be latent pregnancy? It could cause miscarriages. It could cause bleeding. So once we ascertain all these things, we are going to also advise our mother accordingly. We'll also like to look at the brain, the development of the child. Is the brain developing well? We look at the spine. Is it developing well? That there is no something in medicine we call spina bifida. We'd also like to look at the spinal cord, just to make sure the spine is developing well. We also want to look at the limbs to make sure that the 4 limbs are there, the upper limbs and the lower limbs. We also want to look at the fetal abdomen, the abdominal wall, to rule out some of the things in medicine we call omphalocele and gastroschisis. That is the abnormalities that are associated with the abdominal wall formation. So get your time once you're pregnant at this particular period. Visit a hospital, visit an imaging center, so that at least we can do an ultrasound, just to make sure that the child who's developing in your womb is developing well and everything is fine. Thank you very much.